video is specifically for anyone who is working with people needing support for mental health. Whether you run the family or run a company or you are a mental health practitioner, you cannot and should not ignore the history of exposure to childhood trauma when you deal with people with presenting problems. And I'm only focusing on evidence-based insights on how many times more likely are certain conditions if a person is exposed to childhood trauma. And all of this is based on several scientific references, including on Lancet, our own published research in Journal of Community Medicine. I will present the conditions and the likelihood of that condition happening if the person is exposed to certain levels of childhood trauma. Usually the number is 4 or more components of childhood trauma and the increased likelihood or association of such situations happening. First, psychosis. The odds or the increased likelihood is 2 to 3 times more for people who are exposed to 4 or more childhood trauma components compared to those who are none. And this is true in specific exposure to situations such as emotional abuse, emotional neglect as well. And there the increased likelihood is about 2 times. So this is serious data for psychosis. Then we talk about depression. The numbers range from 2 to 3 depending on the sample size and the population studied. Our findings of people who come to us for help, specifically those who are already troubled, that risk goes to 2 to 7 times more likely. So depression has a very strong association with exposure to trauma while growing up. I'm talking about depression during adulthood. Third, now let's talk about personality disorder. Take the example of borderline personality disorder or BPD. Again, BPD is 5 to 15 times likely in individuals who are exposed to trauma compared to those who are not exposed to trauma. And this number can increase depending on the studies you look for. Some of it you can see on the screen. Anxiety is 1 to 3 times more likely in childhood trauma exposure group compared to none. Talking about problematic alcohol use, 5 times more likely. Now all of the subsequent references are based on Lancet article of 2017. When individuals are exposed to 4 or more components of childhood trauma while growing up, as adults they are 10 times more likely to have problematic drug use or 5 times more likely to have problematic alcohol use. And then the suicide attempt risk increases by 30 times. This is more than 200,000 individual study compiled in that Lancet article. So this is serious stuff connecting to childhood trauma. Associations, not causation. Finally, teenage pregnancy is 4 times more likely when a person is exposed to specific childhood trauma components while growing up. So when you look at this presenting problems, I summarize whether it's depression, anxiety, BPD, teenage pregnancy, problematic drug use, alcohol use, all of them have a very strong association with exposure to childhood trauma, and the increased likelihood is in the range of 2 to 30. And therefore, it is not only compelling, but it is essential to ask this question: what happened to you? Not just what's wrong with you.